Thank you for attending the virtual roadshow, and I'm talking to Toy Vermaak from Netcare.
Good morning, everyone. My name is Toy Vermaak. I'm the manager of the Faculty of Nursing and Ancillary Healthcare for Netcare Education. We're a nursing education division of higher education accredited institution. We've been participating in various levels of supporting development and growth of youth in South Africa, specifically in the nursing profession. I think in the last 20 years, we've trained more than 45,000 nurses in Netcare and our other stakeholders. And through education and training, we try and empower the youth of South Africa to also contribute not only to the nursing profession, but to the social fabric of South Africa.
Toy, you have literally decades of experience in the nursing field. Please share with us what the opportunity to become a nurse or pharmacist assist through the YES program can do for a young person's career.
There is always a shortage of nursing in South Africa as well as globally. If you read the literature, you will see that nursing shortages. It's also been requested by the ICN and WHO that we put in concerted efforts to train more nurses because of the shortage of nurses. In South Africa recently, there was a study done by McKinsey with public-private partnership to look at the opportunities for nursing going forward, and there are massive shortages. So the key issue is to train, but we have gone into new programs. So the nursing qualification programs that we used to offer changed. And so now there are new programs that still qualify you as the layperson, know a sister or so, but they're very different qualifications. And because of the new implementation of these new programs, there are some limitations in terms of the numbers that we are able to train, which is quite limiting. But we are working on that. But it's a very good career. The opportunities are really, one cannot really go into how many there are. You can specialize in various fields of nursing. You can work in the hospital, in ICU, theatre, trauma. And then there's occupational health and safety, infection prevention, and many, many, many other specialist areas, education, management. So the opportunities are great. We really encourage people, not only with a passion, that is critical, but also that are intellectually capable and would like to develop themselves, because these are higher education programs, so you need to meet the requirements to be able to fulfill those roles. I must say that a large number of our students are not youths. There are quite a lot of the people who are older who now have an opportunity to develop themselves, who take that option. That says, am I not too old? And then we say we don't discriminate on the age, because as long as not 60 and you want to retire at 62, but we do find that the average age of our new students is around 28, 29. There are new young ones and then also older ones. But yes, there's always an opportunity, and the older people do well because they're more passionate and committed. In terms of the qualifications, the nursing profession is now, I think there's a lot of myths around nursing as a profession. Many people think that nurses only do very basic level work, and the one that they usually quote is carry bedpans and things like that. However, nursing needs people with really high-level capacity to be able to think critically, to analyze information, to interpret it, to make nursing diagnosis, work within the healthcare team in order to ensure that the doctor is informed. Look, the nurse is at the patient's bedside the whole time while the doctors come and see patients. Make sure that all the information that they've gathered through the day is conveyed clearly, and that the patient is cared for, that when you give a patient medication, for example, that you understand the working, the pharmacology of that medication, the signs and symptoms that you may have, adverse reactions. So a nurse is not a low-level person. There are various categories of levels of work that we do in terms of our scope, so you get different categories that are trained in different. But we have many nurses, a majority have bachelor's degrees, basic training. Some have master's degrees, doctoral degrees in nursing. So for those who think that nursing is a low-level qualification, it certainly is an opportunity to advance your career in many aspects of nursing. The diagnosis, as you spoke about, the nurses who are primary healthcare trained run primary healthcare facilities, see patients, diagnose and treat, and obviously refer where necessary. But, in the ICU, you are trained to look after very, very critically ill patients, understand all the medication, be able to advise on the doctor in terms of what's happening. So one has to be really educated, trained, and also have very good experience in the field. In terms of the costs, in the private healthcare, you pay for training. In public sector, there are various methods that they do. I think they also have a system where people receive bursaries to train. I can't really comment too much, but I know that there is opportunity in the public sector, in the public colleges. For the private nursing colleges, our students apply, or the applicants apply, and then they are funded initially by themselves, but we also then liaise with the CETAs in terms of providing support for learnerships. Netcare themselves provide our students with gratuities, which is a funding support and also guarantee of employment on completion of your training. So to support students on various ways, we really do a lot in terms, as Sanjay said earlier, that a large amount of the skills development is the nursing, and we try and ensure that we can support them as well as employ them on completion of training. All right, so in terms of rewarding that I've seen for nurses is that we've seen many of our nurses come through the career pathway from an auxiliary nurse, which is the low level, as we call the lowest level of qualification, and who have some of them even were healthcare workers. That is not a nursing qualification. They started as healthcare workers in the hospitals and developed themselves where they had the capacity to progress and become registered nurses and even progress to specialize in. And I've seen many of the nurses who have done the first and second year programs in the old qualifications, who then furthered their careers and became registered nurses, specialized in various fields. And there's even some who have become unit managers and progressed in management. So there's definitely a huge opportunity for nursing to progress in their career if they are motivated and enthusiastic and willing to put in that effort to get there. I know that there are some of the nurses who have trained with us who started their own businesses in occupational health and safety. So they trained and completed their training and studied further, and then they open their own. Look, there's a lot of opportunities. You obviously need to meet the regulatory requirements. So in any nursing professional career or enterprise that you want to engage in, you need to make sure that you meet the regulatory requirements in terms of the Nursing Council approval and the processes according to that. But definitely there are people who can start their own education institutions if they've got the financial support and the capacity to do so. But I specifically know of some of the nurses who have done their own business in providing home care to people who are not able to come to hospitals, and then occupational health and safety businesses where they provide services to industry, to do the screenings and for health and safety for various other companies. Those are the kind of things I think that I can think of quickly.
I would never have thought that nursing was a normal route starting a business.
There is a scope. Obviously, as I said, in nursing there are regulatory requirements that we all as nurses need to adhere to, our scope of practice, and various regulations in terms of practice. But those are there to make sure that we provide safe care, that our public is also protected, and that we as nurses are protected, and to ensure that the quality of care provided to the patient would meet the requirements. But I think that is something that is embedded from the start, that we are a highly regulated profession for various reasons and obviously very valid reasons. But there's opportunity to be creative for sure.
Thanks for your time. It was great to hear about the exciting work Netcare is doing for youth empowerment.
Thank you very much for inviting us to participate today. I trust that the information that we provided you was valuable. And should you have any other queries, our website, on the Netcare website, there is a careers and education site. Please log in there. There's a lot of information available, how to apply for nursing programs, as well as the prospectus on the various programs that we offer. Thank you once again. Hope to hear from you and assist where possible. Thank you.
That was Toy Vermaak from Netcare.